Louise Tulloh, welcome to Chewing It Over. Why should we care about PROMs?
Because we care about how our patients are doing. We care about their outcomes. Underneath it all, we do.
Yeah, that's a fair point, but why measure it so carefully? People are always bothered about it being a faff. It takes some time. So why does it matter to measure it?
Because we need to be able, we get a lot more value out of PROMs than just measuring their outcomes. And it's unfair of us as working in the healthcare system to be taking resources, financial resources, time resources, without validating that our work and our patients are actually getting better. We need some way to measure that. And of course, there's many ways to measure that, and PROMs is just one of those ways.
So I've been looking forward to this for a little while now because you've got an interesting story into this space. So could you tell us a little bit about yourself and how you ended up interested in such things?
Yeah, well, I guess PROMs isn't the most riveting of subjects, is it? But I am a sport and exercise physician. So that's a doctor that specialises in sport and exercise medicine. And we have those in some countries. We have them in the UK, we have them in Australia and New Zealand. Some in Canada and the US as well, and the Netherlands. So it's not a very well-known specialty, but that's our core. Our core work is the non-surgical management of musculoskeletal conditions and the medical matters that relate to athletes and people who are exercising, like pain, period problems, all those sorts of things, fatigue. So my partner and I, James Lawrence, who work in Sydney together, also a sports physician, we wanted to measure some PROMs, particularly around osteoarthritis in practice, and we realised that even with our good intentions, there was no real easy way to do that. So we were printing out pieces of paper and scoring complex scores and trying to track things. And seeing the future of medicine will be much more values-based, and seeing the value of PROMs to our day-to-day practice and understanding how monitoring progress with our patients and remote monitoring using PROMs would be effective, we just built a platform. We built a platform called ScoreIt, which was designed to make it really easy for people to measure PROMs. So if you didn't know what to measure, we helped you with that. If you didn't have any time, we made it as few clicks as possible, as least time as possible to take out of your patient interactions. And we also set it up so that the PROMs process would continue even if you weren't present. So there was automated follow-up. So our focus was to make it really easy for a novice, someone who's otherwise fairly naive when it comes to PROMs, to measure PROMs in day-to-day practice. And we focused on MSK because obviously PROMs are not just around MSK, there's PROMs around all sorts of conditions. So that's our story. And then the product was, our platform was acquired by VALD around a couple of years back. So it's now part of VALD Hub.
Yeah, then we'll definitely come into the sort of detail on some of the iterations of it, etc., because that's fascinating. But did you have sympathy in those early days from those that say, oh, I haven't really got time for this, etc., and that's one of the things that motivated you to create such an intuitive platform?
Oh, absolutely. Well, there's two. I guess if we talk to barriers to measuring outcomes at all, in a system that doesn't require you. So sometimes we have to measure PROMs for regulators or payers. So we're sort of compelled to do that. But if you don't work in a system where that's value-based or that's not asking you to do that, you have to do it because it adds something to your clinical context and you think it's the right thing to do. So it's got to be beneficial in some way. So we made that platform to be really simple because there's not a chance that we were going to be spending our time with the patient measuring things on a piece of paper and scoring them, which is really difficult. So it's not a chance that was going to happen. So the aim was to make it like you don't even know what sort of PROM to measure. You want to measure a PROM that's regarding a knee, so we gave you a very small and select menu around knee PROMs. So we helped you with what to measure, and then we just sent the email, log the email, off it goes. Patient completes it after the consultation, and then we follow it up later, and it's automated from there. So reducing time during, I think you can't expect to collect these PROMs during the consult. I don't think patients are happy to come and see you and spend their time measuring out a survey, but that information is really useful if you can collect it easily.
Yeah, because I've encountered lots of different sort of people with these ideas that have created various different sort of platforms or systems or trying to motivate this sort of behavior. And they've kind of fall into two general camps. One is always trying with deep sympathy for the challenge that means that they've created as clean and intuitive and simple systems as possible. And there's the other side, which is that this is important enough, therefore I don't care if it's onerous, I don't care if it's data rich in every which way. It's kind of tough luck, and therefore just they're kind of not really bothered about UI and UX, and they've just kind of thought, no, this just it's so necessary that you're just faffing around to do anything too simple. And that second type always just struck me as naive to the challenges of clinical practice. Was it something that really emerged from your own specific use cases in practice, as well as then developing something beyond for your colleagues? Like what was it that motivated those early sort of stages of creating something?
Well, it wasn't just about PROMs. So we wanted to measure PROMs, and we thought there should have been a system that we could use, that we were happy to pay a small fee for, to actually use and collect our PROMs. So we thought that should have existed, and it only really existed in very expensive platforms or with institutions and so forth. And the UX and UI, as you said, was just awful. So we've got to remember that patients have to participate to measure PROMs, so that the user experience for a patient has to be nice as well. So we can't just be asking patients for their important data and not making it a nice experience for them. But the other thing that James and I were particularly interested in is we're interested in digital health and different models of care. So this kind of just melded together to be a project that we just sunk our teeth into, really. We also got early on in our evolution, we also got selected into an healthcare accelerator here in Sydney, which was with one of the private health insurers, because everyone knows that eventually measuring PROMs is going to have to be part of routine practice, and we don't quite know what we're going to do with the data yet. We don't quite know how we're going to share it and what sense we make of it, but it is one step towards ensuring that the things that we pay for in healthcare are the right things.
And did you have backgrounds in tech at that point?
No, certainly not I'm hopeless with apps, which is why the UX, UI is so important, isn't it? But James is really quite interesting. He had another startup, and to be honest, I don't quite remember what it was, but he also created a bit of sporting software, I think looking at rugby scoring and software or something like that for students at school. So I'm probably not doing that justice, but he had a couple of apps before, and much more interested and competent with the tech side of things.
Because I love on this show, especially, I end up having people that have created a solution to a problem, and I love to sort of get stuck into that. And as someone who also loves to build things, I think sometimes entrepreneurs will, in our space especially, will sometimes just take for granted, well, it wasn't there, so we built it. And I was like, well, let's not skip past that. Like, it takes quite particular types of people that spot that and then feel compelled to solve that. The opportunity knocked because it wasn't there, but also you clearly felt that this was an important enough thing in healthcare that it needed to be corrected for. Since doing it, what have you been proven correct in that assertion? And if so, what have you been most proud of in terms of what you were able to achieve in the solutions that it's created?
I think systems are still really slow at identifying that PROMs can fit in. So system uptake is one thing. There are pushes and carrots and sticks everywhere around PROMs that is pretty slow to pick up. But the thing I guess that I'm most proud of is when patients engage with their longitudinal data collection. So we built a system whereby we've had patients, particularly with osteoarthritis, we've had some patients with hip OA that had monitored their PROMs for over 18 months, and we could see we used a Hagos score for them, and we could see their visual chart, and we could see the deterioration in their scores, to the point where that led us to look at those and say, well, now it's time for a surgical procedure because we've tried all these other non-operative things. We're not getting any better. This is not bouncing back. And so they have a surgical procedure, and then we can see them pop up again afterwards. So that longitudinal engagement of patients with measuring their own outcomes is really helpful. And that's been one of the proudest things that I think that I could say is the patient engagement with the tool, with the process. And I guess the other thing that I've really valued as a personal clinician is being able to, I really like to identify psychosocial barriers to recovery. So I really like being able to use an Arebra or something like that to be able to explore where else I need to reach into a patient's problem to help them more. So utilisation of those particular scores has been very helpful for me clinically.
Gotcha. Now, it's all well and good as talking about it being sort of intuitive, etc. But could you please just describe how the system works?
So our system is slightly different from the VALD platform. So shall we talk about the current system?
Yeah, talk about the current system. Yeah. Well, actually, I'm gonna bridge that with a question. Actually, Louise. Sorry, let's just put an edit point in here. Actually, that was a bit of a clumsy rush from me. So, could you tell me a little bit about VALD's acquisition and the way in which the platform has evolved over time?
Yeah. So, VALD are interested in outcomes, measuring stuff, and so they've got all this lovely hardware that measures objective measures, and they had feedback, especially when they went in to move from performance into health, that they wanted also PROMs or ways to quantify subjective feedback around outcomes. So the patient's voice. So that was coming from clinicians, that interest in collecting PROMs as well. And so given their rapid growth, I couldn't possibly say why they acquired rather than built the platform, but they acquired our platform and have been incorporating it through various iterations into Hub. So initially going to be a product within TeleHub, and then it's going to be featured. Now it's like a feature in Hub. So we've got, objective measures within the Health Hub and subjective measures and education. So the product has been tailored a little bit more to live in Hub instead of to live on its own outside of any other software. So it's designed predominantly for physiotherapists, so how they're going to work with exercise prescription, education for patients, and PROMs all in the one dashboard, more or less. So the way it works now is when you're in Hub, so if you do your exercise prescription through TeleHub, say, which is one of the products in Hub or one of the tools in Hub, then you can just easily add a PROM, and you just click on the PROM button. You assign, you pick a side, the back, pain, shoulder, whatever. You get a selection of PROMs to select. Then you can, so there's a default process and how often that comes and how many times it comes, but you can change that default. And then that's sent off to the patient and it's automated from there. So the app actually sends a reminder if the patient doesn't do the PROM and comes around, does it again the next time. And so the patient can see their results as well as the clinician. So next time you see a patient, the results are sitting there for you so that you can be monitoring their progress with their PROM.